Welcome to Houston House at South by Southwest. I'm Natalie Harms, editor of Innovation Map. Home to the largest medical center in the world, Houston is leading the way in the development of world-changing innovations in healthcare and life sciences. Johnson & Johnson is one organization empowering innovators across a broad healthcare spectrum. Their largest innovation footprint in the U.S., JLABS in Houston, has a diverse portfolio of companies that are creating and accelerating the delivery of life-saving solutions to patients around the world. Fiona Mack, head of JLABS at the Texas Medical Center, joined me for a conversation on how Houston is quickly emerging as a hub for life science innovation. Fiona, thank you for joining me today. It's so good to catch up with you. How have you been? How has the job at JLABS been? I know you moved here around 6 months ago now, so you're a true Houstonian. You survived a weather storm with us, and you came out on the other end. So how has it been?
An adventure here in Texas. So it's a pleasure to see you again. Thank you so much. Yeah, so 6 months, I've become the head of JLABS, which is our incubator experience here. Had some personal changes too. I gave birth to my little girl back in December.
Congratulations.
Just, not too long. And then she experienced her first snowstorm here in Houston as opposed to on the East Coast. But I got to say, I really enjoyed being part of the Houston community. From both a personal standpoint, everyone has been great with outreach. And then from a scientific standpoint, we're really making some nice inroads into the companies that come into JLABS.
Yeah. So is it true? I think I just read this. So this is the largest JLABS, the Houston location. So how is that?
Well, that they say everything's bigger in Texas. So we get to occupy this space that is right in the Texas Medical Center. I believe this is the old Nabisco factory that they have. So we still have some footprints of the whole cookie industry that's there. But the access to space allows us to really go in some different avenues that are quite unique to Houston, particularly when we're looking at 3D printing. So we have a large collection of our companies are focused on medical devices, and that's been really quite prestigious for them to have that extra utility in that space. So it's been, you said, we're trying to make the most of all the space that we have. And quite honestly, during the pandemic, we've still been at, about 70% capacity for a lot of our lab attendees.
Yeah. So how many startups operate out of the JLAB space?
Okay. So within the Houston, we have about 40 companies.
Okay.
And they range from, just one or two people really trying to make a go out of it themselves to those that are really expanded upon to be at clinical stage companies. And so our portfolio of companies kind of ranges, most of them are focused on pharmaceuticals, meaning actual making drug products to be given to patients. And of that 60%, about another 6% are really focused on oncology. And that probably given our proximity to MD Anderson and a lot of the other prestigious oncology institutions in the area. But then the other component is really made up of, Johnson & Johnson focuses heavily on consumer health. So that's a component of our portfolio. And also, once again, the medical devices. We sit right next to an investment from Johnson & Johnson called the Center for Device Innovation. So they're really into kind of prototyping new innovative medical devices. And so we have a lot of our companies are kind of tied with their interactions.
So we mentioned that you are relatively new to Texas and you came from the East Coast. What has it been like kind of really diving into what's happening here in Houston? And I know we love to compare Houston to other coasts in regards to our innovation ecosystem and where it's at. So if you offer any insight on that, I'm sure people would love to know.
I would say as we were talking about kind of the portfolio component of it, everything still kind of skews very heavily to pharmaceuticals. Oncology is a strong focus of the organization. So all sides kind of are competing for the best of the oncology companies. One thing that makes Houston unique is all of the clinical trials. It's still within the nation, one of the places where we do the most clinical trials, over 10 million plus patients are actually treated here. So there are a lot of companies that are attracted to this area to begin with. And so that gives us an advantage, I think, over perhaps Boston and in California, just in terms of access to patients. And as I said, once again, a different aspect of the portfolio is really kind of the medical device industry, which is kind of expanding. And the kind of tying that with a lot of the data sciences initiatives that are ongoing within the area. So you have the Dell Medical Center has a large kind of computer science program that's very geared towards the healthcare industry. Kind of all tying that all together is kind of leading us into this next frontier of how do we use big data to not only do kind of early drug discovery, but really to kind of expand our access into healthcare. So that thinks it makes it very unique in terms of this third coast idea that is, still kind of ramping up perhaps in some of the other areas.
Yeah, and you have a very kind of all over the place background, all over the place within life sciences. So what role do you play for these startups and for JLABS in general? Because you really come from all various stages of companies, even oncology and beyond even.
Yeah. So I'm hoping just to be the strongest advocate, right? So our goal for coming here, although there's a nice, good ecosystem, we still want to keep it energized and sustainable over time. So having a foundation like Johnson & Johnson in the area is meant to provide mentorship in many ways. Also provide some guidance on getting financial support, getting investments, drawing VCs to them, and then ultimately to also provide them collaborations for Johnson & Johnson as a whole. So my job is kind of a liaison, right? So I make these introductions to people. I try to highlight their companies that we really think have a very high potential for success. And also just to provide, as I said, that aspect of mentoring. So for many people, this is very new. They don't necessarily have a purview on how drug discovery is done or how to work with large pharma. So my background, although it's been varied, I've done different therapeutic areas. I know large pharma. I know what they're looking for, and at least how to articulate that to some of the early startups. Because for any kind of success and collaboration, there has to be this level of trust and an understanding of what the needs of both sides are. So I'm hoping, as I said, I'm that bridge for our startups to how to navigate the broader Johnson & Johnson enterprise, as they would like to say.
So interesting time to be in healthcare, of course, during this pandemic. So I'm really wondering from your perspective, how has it been? What has it been like to work in the life science arena during a global pandemic?
Yeah, well, I think we're all living through this, right? And I think there can be some positive aspects that come from it. First, it's really maybe this transition to virtual. One of the challenges that we said with being in a third coast is that everything is kind of centralized on the East and the West in terms of investments, in terms of other kind of key opinion leaders. But now that we're going virtual, we're able to really expand out all those resources. A lot of our programming for Johnson & Johnson has gone globally. Since no one's traveling, our schedules have opened up a bit more, so people are more willing to make these connections and talk with people. So I think that has really benefit or will benefit from a lot of our companies and not having to be restricted in the localization here. The other aspect of it, I think that Johnson & Johnson is focused on as a whole, is that this pandemic has really highlighted a lot of the healthcare disparities that are present within our systems. And there's certainly initiatives that Johnson & Johnson is taking from a diversity and inclusion method to kind of pledging over $100 million over the next 5 years to really address healthcare disparities. Houston itself is in a unique position to address that, not only with, they said, the number of clinical trials that they're doing here, but really the collection of academic and healthcare institutions that are in the area, kind of really serving either underrepresented or at least a racially and socioeconomically diverse population. So one of Johnson & Johnson's goals is to really try to bring in healthcare equity also within our clinical trials, so making those much more diverse, in addition to helping to support the community and with a lot of other technological advances that really bring access to the same populations. And so that has been something quite striking in the pandemic times, that people have really been able to mobilize and really create actual concrete action points in which to follow through with as we continue in this space.
Yeah, absolutely. And when you think about kind of what the digital transformation as well as the pandemic has really meant for life sciences, especially in the innovation ecosystem, the medical community put out a vaccine in less than a year, which had never been done before. So these types of rapid kind of growth scale opportunities, is that here to stay after this? Or did we jump forward a few years in time?
I talked to some friends of mine about the Moderna and Pfizer vaccines and how in the past we just never would have done that for basically cost. There are cheaper, perhaps longer term ways in which to do that. So will we maintain that level of speed in the future? And, I think there's always going to be that balance of it. From our perspective, I think there have been some changes to how we go into clinical trials that will be sustained, like how to ramp things up very quickly, how to pivot, how to basically identify programs and accelerate them a lot faster. I think some of that will stay. I'm hoping that we still maintain this basic philosophy of, out of necessity, we become much more innovative, and hopefully with the way we're able to work and collaborate, even in this virtual environment, we'll be able to sustain that going into it. But I think, as you said, with this push for digital healthcare access, I don't think that was changed, because we're all starting to begin to see the benefits of it, and more the fact that it's working, right? So as long as it's working, people can continue in the future. And so I think our industry is changing a bit. As I said, there's always some aspects of it that has to be done in-house. Like, we have a lot of lab work, people are coming in, but then other aspects of it, I think we're really continue to see that being done virtually and done remotely. And how to maintain that sense of community, I think, has been our biggest challenge.
Yeah, absolutely. And especially here in Houston, we have the Texas Medical Center, which is the largest medical center in the world, and we see a lot of opportunity for that as well, at being here in Houston. But Houston still isn't necessarily considered, depending on who you ask, isn't necessarily just kind of considered a life science hub. And so, what's changing in that? Is it changing, or, what do we still need to work on?
Yeah, I mean, I didn't consider, besides having some interactions with the TMC, you don't necessarily consider it the life science hub. And I think it's because you don't have some foundations of historical companies here that are really based there. You're starting to see more in the tech sector, with Oracle coming. You'll have some very large, powerful companies in that space here. Oil and gas and renewable obviously are making some inroads, but we haven't found like a pharmaceutical company that has been here for 20 years and that you can build upon. So I think until you kind of see some companies begin to stabilize and be able to grow while still in Texas, you'll still have that barrier to really think of it as a life science hub. But that doesn't mean that maybe it doesn't need to look like a San Francisco, and it doesn't need to look like Boston, which has their own challenges. Can we create a niche for ourselves as we talk about how we do clinical trials in this area? Can we have a lot of companies perhaps focus on phase 1 studies or very early programs, and that could be the centralized focus for a life science hub in Houston. But we still need to start building up all the other infrastructure really to kind of support that particular type of industry.
Yeah, what would be the niche if you had to zero in? What could be Houston's ticket to really getting that top spot?
So I'm curious. I mean, obviously Johnson & Johnson is pretty much here to stay, at least from a JLABS perspective, and fostering that early stage innovation. But these are early companies, right? So as I said, 1 or 2 people, sometimes expanding, and we want to be able to retain them in the area, and so that they can grow. So part of that is really having venture capital investment to be here, access to the talent pool. So we're certainly focusing on how not only to educate, a lot of our medical students that are being trained, but also to educate them in how to be entrepreneurs, and then how to do basic drug discovery. And that's something that you only know by doing in many respects. So where do we think that the niche should be? As I said, I like this intersection between data science and healthcare initiatives. And so what we're trying to do is kind of, bridge there, utilize some of that computational work, not only in when we kind of identify new targets for diseases, but also with how we implement them in the hospital and the other administrative aspects of it. So having someone that's in that space, I think, is going to be successful.
Yeah, and there's tons of opportunities within healthcare for data science disruption. I mean, there's so much data going on across the Texas Medical Center and across Houston and across the world. So that's a really great opportunity too, like almost maybe software is what you're leaning toward, or more than that?
I'm thinking more software or computational biology, some aspects like that would be useful. I think that would be a unique spot to be in for that work.
So we've talked a lot about, where the Houston innovation ecosystem is going, but, what do we have going for us already? Of course, the Texas Medical Center, but what else?
And so we're also thinking that the Texas Medical Center begins to expand. It talks about their TMC3, which is going to be the gorgeous shape of a double helix, so when it gets formed. But we understand all of the academic institutions that are tied within the medical center. But I'm also thinking outside of Houston. There's been this discussion on how to, we think about the East Coast and West Coast. We also understand that there's a research triangle, right, between here, Austin, Dallas, San Antonio. Well, not quite a triangle, but the Texas formation. And sort of having an alliance that utilizes all the academic research institutions within that area is definitely a strength. I talk a lot about, the new medical center that was built for Dell, and their really high supercomputing capabilities in that area. That kind of tied in with all the healthcare networks within the area, I think makes it very strengthens the area, makes it a real resource. So Houston itself, we on itself be a life science hub, but perhaps incorporating the rest of Texas is also going to be a clear strength of the region that we have. And so it's one reason why we're, as I said, kind of here to stay within Texas. We also, Houston being the fourth largest city, it's growing like leaps and bounds. It has, I think, one of the most diverse populations within the area. And that all can just benefit us from, as you said, a political aspects of it in terms of the initiatives that we're trying to do to address healthcare disparities. And that's going to be the strength of the region and what's going to make it unique going forward and how we are able to utilize its resources.
I wonder if I can put you on the spot and just talk about what you see the future of Houston within life science being. Obviously, you mentioned TMC3 as that develops, but what does it look like in the future for you?
So trying to think of what I would like to see our site, I really want it to be like a very competitive way where it's no longer it's only going to the coast for this. So we're thinking not only from a Texas region, but really how to think about the whole middle of the country to get access for it. So we're doing a lot of outreach to not only Texas, but also to some of the broader regions. But where do I actually want to see Houston go forward in the future? So I'm looking to build up some of our aspects in medical devices. I think that is, devices come at something like physical that you could actually put into heart, but also how we improve surgery, but also a lot of these digital techs that we said to increase healthcare access and understand how we can actually distribute it to the community. That would be something that I'm thinking that's going to kind of expand within our own portfolio. And those type of devices really kind of bridge all aspects of our healthcare, not only from we think about particular therapeutic areas like oncology or immunology, but also to what we can do within a consumer health. I mean, we're seeing kind of personalized care even branch into what you want to do for your skin benefits and all your consumer products. And that is something that can really be expanded upon within our own region.
Yeah, it also seems like with telehealth really taking off in 2020, there's a lot of opportunities for at-home medical devices. Mm-hmm. So there's it's ripe for disruption, I'm sure.
Absolutely, yeah. And so we just need people to try, right? Unfortunately, I think I work for an organization that's very open to that, very supportive of having this innovative aspects. That's what the incubator is intended to be there, but always having the long-term view, like how do we support that for future disruption? Everyone understands that your own business can be disrupted, and so keeping an eye on how that's happening and being engaged in that is important to Johnson & Johnson. So we'll see what Houston will come up with. But we said we have a lot within our portfolio. A lot of the entrepreneurs I see are really trying to push the boundaries, and we're just hoping to be as supportive as we can.
Yeah, absolutely. I know we can't necessarily walk through JLABS right now, but if
we have a video.
We have a video. Well, there you go. I was going to say, like, what would it be like walking through, if you could hypothetically walk through and see what the portfolio companies are actually doing right now? What's that like?
Yeah. So our collection of space, we have ideas of like concept labs. They're kind of smaller places where people can not so much tinker, but really create some of their prototypes for what they're working on. We have some basic life science biology labs, where we're working with animal cells, doing tissue culture, generating antibodies, understanding small molecule development. And then there's a subset that's also chemistry focused, for those that are doing just straight small molecule drug development. So it's actually kind of a nice posh place where you wouldn't tell there was an old cookie factor by walking through it right now. But as I said, right now we still have, with social distancing still in place, we still have about 70% of our companies have come back because the work is inherently needs to continue in order for them to continue to grow. So we have a lovely atrium. We still have to have some space that we think for community feel. So hopefully when we get back up and running, we'll be able to have everyone back together again Just yesterday, we did or I guess it was on Tuesday, we did a Texas Tuesday. So it normally would have been like a chili cook-off, but we had to do it virtually. And so we provided people with like at-home lunches, and we just kind of talked a bit about the science. So one of our new onboarding companies is really focusing on oncology, has some very unique ways to address immuno-oncology resistance. And so we try to use that as a platform to have our companies still talk to each other, get abreast of what each other are doing, and foster our own collaboration. So even though we can't all walk through JLABS at the moment, we're still trying to have that sense of community that JLABS offers for the entrepreneurs.
Yeah, definitely. The lab space, the community is really the difference maker for JLABS. And I have some FOMO that I didn't get the chili cook-off, at-home chili cook-off meeting invite, but that's fine.
Another time, yeah. You come to JLABS, we'll put a pipette in your hand the next time you come.
Oh my gosh, I'll feel like a real scientist. So it's so incredible to hear all of the things that you're doing and JLABS is doing here in Houston. And to your point, it's making Texas better as well. So thank you so much for sharing that and how much of a focus bringing Texas together is for you and for JLABS.
Thank you again.